I'm now with Michael Kerman of PCH Alliance and Continua. Michael, you and I have known each other for a long time, and you're now associated with two organizations that are very current, but HIMSS is your parent organization. Can you tell me how HIMSS relates to Personal Connected Health Alliance and Continua?
Yeah, so HIMSS is a large organization with its flagship event here in Las Vegas in a couple of months, in early March. It's about 45,000 people, nothing like CES. However, HIMSS really has driven the field inside, let's say, the clinical environment. I mean, they do much more than that, but as compared to Personal Connected Health Alliance, we're trying to drive the field outside of the clinical environment. And then also the new leadership within HIMSS, Hal Wolf, both of which have really been behind Continua, behind getting the field defined. And I think we're really seeing some progress with them at the helm.
And for those of our viewers and subscribers who know less about your part of the industry, tell us a little bit about the day-to-day work of Personal Connected Health Alliance.
Yeah, so Personal Connected Health Alliance really does several things. There are 5 different buckets: thought leadership, convening, collective action, really trying to bring people together and drive the field. They try to raise the bar with the continuous certification program, for example, and then they do research. And a lot of research has been done just in the last year. We recently put out research on for personal connected health policy. So we've looked at the landscape. We've also done adoption playbook for, let's say, the demand side, which is really getting ministries of health and large governments all on board with, let's say, a common vision for interoperability for health, medical, and fitness. And then as well, we're looking at other things. In the next few months, you'll see an industry adoption playbook. You'll also see white papers on how the Continua design guidelines do privacy and security. We're working very closely with other alliances. We have key alliances such as the IEEE. IEEE is working on cybersecurity right now. And then we have all of our members, right, that come together and try to drive the new thing that's needed. In this case, it's what we're calling the IoT direct-to-cloud.
And you talk about creating guidelines. Are you involved in standardization at all? Yes,
we're not directly. So we profile guidelines. A good example is the Bluetooth specifications, where Bluetooth, has too much optionality or profile that does not profile enough. We come in and we say, well, you have to have this for remote patient monitoring. And for example, Bluetooth security, you have to have 4.2 or later in some instances. That may not be the case with every different type of device capability that we have, but in general, that's the case. That's what we do. But we work, that's on the device side. On the service side, we are one of the very first to really do end-to-end as an interoperability standard and to make it work. But on the services side, we work with IHE and HL7. So.
Okay, and I believe you've recently announced a new CDG. Can you tell us more about that?
Yes. So a few years ago, we tried to do the SOAP SAML, some of the same stuff that the industry was doing, but not really taking off. And so what the industry did is regroup, especially on the service side. When I'm talking about HL7, for example, they had what was their version 2 and their version 3. Version 2 has done well inside hospitals, but in the US. Version 3 hasn't really gone anywhere. Even though we profile version 3 and 2, it's HL7 Fire that has really got the hype today. And actually, it's a little bit more than hype. We've seen real evidence of companies, open forums, everything. It's open, it's free, it's easy to grab code and build with it, and people donate code. And so that's the model that we're picking now. So.
Okay, and your reach is global? You're working
it is.
Yep.
Yeah, very good question. The CDG Continua Design Guidelines, this is our 8th release. All right, so over 10 years of building this thing, and then just about in 2014 we went to the ITU, so that's the UN standards making body, and they consented our guidelines, the whole thing, including all of our test suites as well, and then they convert the guidelines into 6 different languages worldwide. So we believe we could easily call our standard a global standard for that reason. So.
Okay. Well, you and I both have a background of involvement with Bluetooth technology, and I learned about interoperability in those days.
Yeah.
And it was about whether your phone worked with your headset or stuff on that sort of level. You operate in a very different part of the market. What is medical grade interoperability?
Yeah, so medical grade interoperability is really because you have a medical device in a dynamic environment going over multiple time zones, localization, you have all these issues of battery and abrupt loss, many of the same issues that Bluetooth and other things have had. However, if that data, that contiguous data isn't clear that it's relevant, then a provider will not accept it. Matter of fact, they even throw out the data. Yes. So the biggest problem is making certain that data is done correctly. So what we've done is we've actually built the guidelines for timestamping and synchronization. And so we say how that's done, and we continue to improve one in Bluetooth with their new times protocol. And then also our people are at the IEEE doing the same thing there. Same thing in HL7, we drive our people there and they align them. And we work very closely with the VA, the FDA, and other organizations worldwide to make sure they understand it.
So you're working with a lot of powerful organizations, whether they're regulators or commercial companies. Are they all welcoming the work that you're doing?
Absolutely. I don't think there's a question. It's a timing thing. It's always been about reimbursement and how do you pay for these things. And I think this is probably our inflection year. Why? Because the U.S. finally does have some reimbursement in its policies now. Mm-hmm. And we're seeing similar in Japan and China, and well, not so much China, but definitely in Europe. And there are a lot of interoperability discussions, right, about getting together and making something work, and they all gravitate to Continua when that happens. Continua is really the only one out there for remote monitoring that does with end-to-end. So, profile.
Well, I said this in our roundtable discussion, Michael, but I consider that a lot of the technology that is being pushed into the market today falls into a nice-to-have category, but I think you're dealing with stuff that's really important and it's really valuable. So I wish you good luck and I hope it works well for you. Thank you. And have a great CES.
Yeah, thank you. Looking forward to it.